Joining us this week on The Informed, we have Caroline Council, one of Australia's leading family law lawyers. We also have Ingrid Maynard, who's known as a sales doctor, and she's also the co-founder of the Victorians Party. And again, joining us, we've got John Heron, the father of Courtney, lawyer and advocate for the victims of crime, and the recently announced Liberal Democrats candidate for the federal seat of McEwen. And we've also got one of Victoria's hardest working and most honest politicians, the Victorian Shadow Minister for Planning, Ryan Smith. Welcome, team.
Okay.
Morning.
Now, the vaccine mandate, which according to Brett Sutton, the booster, he wasn't consulted on, he's given no advice. Given the appalling lack of control in the aged care homes that we're seeing, with over 400 deaths just in the first month, is this something that we should be considering a mandate?
Well, if I can kick off, I think the revelations in the parliamentary hearings that Brett Sutton had not been consulted on this proposed mandate for the third booster is just appalling. I don't know why it's not front page news everywhere. The fact that he said that he's not responsible for giving advice on that issue, on suspending IVF procedures, on suspending elective surgery. I mean, this is just nothing more than solid proof that the Premier's been making it up as he goes along. Is it any wonder that people have no trust in governments when we hear that these matters that have such a profound impact on people in so many different ways are not even being guided by health advice anymore? I mean, it makes us wonder what of the myriad of other decisions that were made over the last 2 years actually were by health advice as stated, or whether the Premier, as I said, is just making it up as it goes along. This is blatant lying to the Victorian public. And I'm flabbergasted that it's not bigger news right across the country.
Yep. One of the things that I'm always highlighting is the fact that overseas mandates are dropping everywhere. So again, I use that bridge analogy, but last night Sweden announced it's scrapping any type of restrictions and mandates. But importantly, in the UK, the NHS is rolling back mandates for even essential health workers and allied health workers. So that's only in the last few days, because they move quickly to the evidence in front of them. My spouse at home, on the flip side, has been notified that in 2 weeks' time, as an allied health worker, it's mandated for her to have a triple jab.
Or she doesn't have a job.
Yes, well, not allowed to practice. Literally, it depends in what situation.
Yep, absolutely.
It sort of goes back to that whole lack of rat tests as well, because they're almost using the mandated booster as well as the double vaccination as some way to get around the disaster that's happened in relation to not making rat tests available. They've got to get a coordinated approach. And I have to take up Ryan's point. I think it's appalling. Brett Sutton is also in Supreme Court action, which is coming up for trial with the teachers. Now, if he's been cut out of decision-making by the Premier, how on earth is he going to defend himself in Supreme Court action? And I know that relates to the double vaccination rather than the booster, but it just goes to show if he's been cut out, litigation is very problematic for him as the Chief Medical Officer, Health Officer.
Now, the problem...
So I think the other question here is that if those decisions are being made by the Premier without taking on board health advice, then clearly I would suggest that perhaps there isn't health advice that he's basing his decisions on. And so the question I'd like answered, which we won't have answered because he doesn't like those sorts of questions by our Premier, is, what's really sitting behind it? Because it feels an awful lot like control. And that's something that our Premier seems to really delight in. And that's evidenced again. Now, that's if we believe Brett Sutton, that he wasn't consulted. He might have his own reasons for saying that he wasn't. Who knows? I'm sure that will be revealed in the coming months. However, if that is true, then it begs that other question to be asked.
Now, we've seen Martin Foley come out with some very weasel words where he said he had consulted, and then it was, no, well, I've had discussions with Brett Sutton, but he hasn't given advice on it, but we've had numerous discussions. This just further undermines the trust, transparency and accountability that is the hallmark of this government. When we see the information officer, Sven Blumel, saying the whole system needs an overhaul, this government is just undermined any trust, and that's where the problem lies, in my opinion, with having to force people to take mandates. And we all know that autonomy is such an important thing. It begins with the terrible twos, where we want to have that control of our own lives. And this mandate, I think, will only drag things further back and make people more resistant and more resentful.
I've been out through my electorate. Last weekend, I was out on the street corner with the local federal candidate here, but the overwhelming issue that was being brought up with us over the course of the day was about mandates. It's about the government telling us when we had your 2 shots, life will be back to normal. The government saying that if you get vaccinated, life will be normal, and life is far from normal. People are isolating. I mean, I've got at the moment one child who has COVID and he's in his room. I've got another healthy daughter who's banned from going to school. It's just, this isn't what we were promised. This is not living with COVID. This is just continuing in a maybe a reduced pattern of what we've been doing over the last 2 years. It's just got to change, and this is why people are reluctant to get the 3rd shot. And certainly, if the Premier brings in a mandate for this 3rd booster, there will be pushback, I am sure, because we just can't continue to pull people out of work, pull kids out of school. It's just verging on ridiculous. It's been going on for 2 years, for goodness sakes, and we don't seem to have progressed in any way.
Yep, 100%. I totally, absolutely back everything that you've just said there. And, the businesses that I speak with on a daily basis are absolutely crippled by not being able to have staff work. Look, they may or may not have COVID, who knows? But because of the way that, there's so much confusion about, those close contacts, that definitions keeps changing, and no one is really clear about why that keeps changing, where the information is coming from. In addition to that, how long people need to isolate for, what isolation looks like. It doesn't look like isolation to me in a lot of cases. And in addition to that, that uncertainty that businesses really need certainty. They're not getting that at all from this government. And you're absolutely right, Ryan, when you say that, we were promised freedoms on a double vaccination. It hasn't happened. Yes, we're not in a formal lockdown, but we might as well be.
It just shows that government can't be trusted because of the inconsistency in the messaging, Ingrid, which is really what you're saying, that there is no certainty. They're making that up as they go along, which is fine if they said, we don't know, we don't have a clear pathway, this is what the science says, this is what our chief medical officer says, this is what we think is best. But they're not even doing that. They're just saying, no, this is it. And if you all do it, we're all going to be fine. And then we find out we're not fine. That I think is the issue. Matthew Guy's stance, Ryan, I think is really interesting, because he says, don't mandate, educate. And I think for business owners who might be apprehensive about their employees, I think it's a really important thing for them to also be able to make some decisions with certainty and be able to be in a position to access resources to educate their teams, their staff, so that they have the safest working environment possible in this situation. But at the same time, we don't want employers to be accused unfairly. If they've implemented all strategies that are available to them, they should also be free of prosecution, I would have thought. So, Ryan, I'm interested to hear from you about, your party's stance generally in this regard.
Yeah, well, there's a few things in that. Firstly, I think that we're not getting enough information about who is most at risk, particularly from the Omicron strain, in terms of it being hospitalised and being put in ICU. If we had that sort of information about demographics, and employers at a cafe, for instance, who perhaps employ mostly under 30s, under 25-year-olds, if they're made aware that the at-risk demographic is much older, then they would feel more comfortable. And you're right, employers have got a lot of responsibility put on their shoulders at the moment. They're not being given the information to make informed decisions, and that's part of the problem. I've actually put questions on notice into Parliament to the Minister for Health, asking about the demographic breakdown with regards to the risk. And I think that's important information that needs to get out there so that we can have a proper conversation about who should be going to work and who shouldn't be. But as far as our position on the mandates, as Matthew's been very clear, and you've got to understand, parties that aren't in government don't get the sort of information that parties that are in government do. So we are driven mostly by the information that's being put out at National Cabinet, so that the information that the federal government's getting. Federal government's not mandating a third booster shot. Federal government through National Cabinet is, however, saying that those who work in aged and healthcare do need to get do need to be mandated for the 2 vaccines that we originally started with decisions pending on the third booster. So the best we can do with any credibility, I suppose, is to follow the advice of National Cabinet, because they have the information that in opposition we simply don't get. And no party who is in, whether you're an independent or one of the minor parties or a party such as ours, it's possibly, hopefully, the alternative government, we just don't get that information. So we're driven by the National Cabinet, which I hasten to add, National Cabinet comprises of all the premiers, including our own. And what's incredibly frustrating is for Daniel Andrews to go to National Cabinet to be part of decisions that are made and then come back to Victoria and do something completely different. The premiers have a lot to answer for, many of them. I think Mark McGowan didn't even turn up at the last one. So, what's that say about collegiality and doing what's best for all Australians?
Yeah, there's a lot of mistrust in picking up on our point there, Ryan, about the figures released and the numbers and the statistics. I was looking last night, the ABS has released a stat that the average age of a death with COVID was 83, and they were talking about 89% double vaxxed in aged care homes. But I'm not getting into hearsay, but I've heard a lot of reports over the last 12 months of in aged care individuals that they've been cause of death put down as COVID.
Oh, many,
Many. And I heard situations where a loved one is dying in a facility or hospital. The hospital administrations come up and say, can we tick the box that this person passed away with COVID? I had a very disturbing thing yesterday, and it could be scuttlebutt, of a hospital where an administrator came up to an elderly woman in her 90s to the family and saying, look, and again, I can't vouch for it, the person telling me has credibility, saying that the hospital would receive a $25,000 bonus if they ticked a box if they were deceased of COVID, then turned around and said, if you tick the box, we'll split the difference.
Oh my God.
Now that's amongst other questions I've asked in Parliament, if there is a payment,
yes.
And also what percentage of those who have died of COVID had comorbidities that could reasonably be contributed to the death? So I've asked these questions. We'll see if I get any answers.
Yeah, look, I put the last bit about the splitting the difference. I had some doubts in hearing that, but would any of us doubt it if it actually was true?
No, it sounds true to me.
Fortunately, yeah. Right. Lack of trust.
So we'll see when we get answers to those questions. And
yes, that'll be good.
They've got months to give me the answers. Often they're very late.
One of the other things that seems to be at the forefront at the moment in the news, and given Brett Sutton's revelations in the inquiry the other day, is the elective surgery ban. Now, elective surgery is such a misleading term. I think it should be renamed as scheduled surgery. So it just means surgery that they go, right, on this date, we will relieve your pain, we will enable you to work, we will enable you to toilet yourself, to be self-sufficient. From this date forward, you should be able to begin a recuperative phase where you get your life back, where you'll be able to be mobile and all of these other things. And we see that Brett Sutton did not advise the government to stop this. And given that Daniel Andrews has been in charge of Victoria's health system for 11 out of the last 15 years. Is this just more covering? Is this another opportunity for the Andrews government to deflect on what has been exposed by the pandemic more than created by the pandemic?
Well, it's a simple fact that no other state currently has a code brown and suspending elective surgery. And you're right, elective surgery is a misnomer because there's people literally living in pain every day, and every day that the government continues to lock down elective surgery is another day that they're in pain. Bearing in mind that there was over 50,000 people on elective surgery waiting list before the pandemic. That's blown out significantly since, and will continue while we have doctors not doing that sort of work. So it is that you can't come to any other conclusion than that the government knows that their health system is hanging by a thread and simply is trying to give it some sort of reprieve. But it's short-lived. I mean, all these people are not going to go away. They're just going to still be waiting for their surgery. They're still, and the list is going to continue to grow. I mean, he's going to get found out sooner or later.
Yeah, I think the health system, I think what COVID's done is simply expose the cracks that are there. And look, I've heard tales from friends waiting for so-called elective surgery, walking through hospitals that are empty. You cannot tell me that personnel has been shifted from very highly specialised work into the general COVID hospital population. It cannot be true. They're sitting at home. They're not working. That needs to be addressed as well. It's lunacy. It's, as you say, there are people living in pain. These are people that also employ others. These are people that keep the wheels of industry turning, that are not performing at their best because they are in pain.
Yep. These are mothers, these are carers, these are workers, these are employers. These are part of our community, and everyone matters. And you're absolutely right when you say that, because, you know, there was a friend of our family who had a brain tumor, and she had to wait 8 months. You know, with you know, that is life-threatening, but it's classified as elective surgery, and you know, that, and it's just one of many examples of what we're talking about, going on a different path to the rest of the country.
And it's also the hidden incidental COVID deaths that I don't think have been properly identified. People that haven't been able to get into the health system and they have died as a result. And I know of people that were waiting for tests to come back to establish whether they had COVID or not, to enable them to go into hospital for emergency treatment, dying whilst waiting for the PCR test to come back.
Some data released during the last few days showed per capita spending on health in Victoria was the lowest in Australia.
My God.
And it was, I think the figure was $2,936 per capita was the average in Australia. Victoria was something like 2,600, so a good 15 to 18% lower than the national average. And again, I ask, does anyone doubt that number?
Yeah.
And the government hasn't pushed back on it either.
Yeah. Some of the other reporting just recently as well, in the last 12 months, there were roughly 2,700 less cancer diagnoses. Now, that's not because cancer suddenly went away. That's because of this ban. Elective surgery actually includes biopsies, you know, investigative work. So those 2,700 less diagnoses from all types of cancer, and we saw in New South Wales they stopped the breast screening for a little while. That's a can getting kicked down the road with horrific consequences in the long term. But I couldn't imagine living under that amount of stress, going, right, well, I've got this lump, bump, whatever you want to call it, I've got this prognosis that hasn't been confirmed yet, and I'm being told to wait while the surgeons have come out saying we need to restart. The patients are saying we need to restart, and the hospital's going, well, sorry, and the government, Andrews, not the health officer, is going, we just need to wait just a little bit longer, please bear with us. And he's patronising, we know it's uncomfortable, we know it's this, we understand all of it. Please don't patronise, take some action and do something.
Absolutely. Guys, I'm going to have to go. Thank you so much for including me in today's discussion. Fantastic topic and really important. I'll see you next week.
Thank you.
Thanks, Ingrid. So where do we go with elective surgery, Ryan?
Well, we are as a party calling for it to be back on. Basically, we want to have all those people who are suffering in pain, those people who need those diagnoses, as you mentioned. They need to go back and they need to go to their doctor. They need to find out what's going on with their lives, and they need to get on with it, and they need to stop living in pain. So elective surgery should be back on. Well, the government should give us a good reason why not. And frankly, the reason they've given us to date, which is health advice, we've since found isn't true. So why are we still in this situation? We need to get those people looked after as soon as possible.
And Ryan, why is it that the YouTube impassioned plea from a woman wanting to access IVF gets the attention? And as I've said to people I know in pain, serious pain, people that can barely walk because they require hip surgery, for example, I've said it seems to be the only way to get the attention of the Premier is to post a YouTube video and cause a conniption or an uproar sufficient to get action happening. That is an appalling way to make decisions about who receives health treatment in our state.
We've seen similar issues when we raise specific matters in question time where the issue is dealt with, but only because we raised it in question time. I mean, every single person on the elective surgery waiting list should not have to have their issue raised in question time in order to get anything done. I mean, I'm with you. And that particular clip you're referring to with the IVF person was basically, just 48 hours beforehand, the government said it was going to be at least a month before they put IVF services back on. And yet with that, 2 days later, they're back on again. Health advice or political pressure? I mean, it's clear which one it is. And if we need to have people lining up doing YouTube clips to get some action from this government, maybe that's the way we should go. We've presented as a party some people who have been waiting for elective surgery. We had someone who had a back injury similar to the Premier's, may I add, who's been waiting in excess of 2 years now for her to be seen to. And the point being, there are so many of these people, some prepared to go on camera, others think that they're going to get targeted if they do. But yeah, we need to put as much public pressure on the government as possible because it is simply not acceptable.
I think with IVF, really the Victorian government, as you'd expect, is just playing to constituents where there's the most political mileage. But Michael, I was telling you the situation of my 10-year-old son back in November where he has cleft palate surgery. Now that's deemed to be elective, but not only elective, but actually cosmetic, but that's another story. So the first time he was going into hospital in November, there was one of these ridiculous 14-day isolation rules where someone within the school that really didn't have COVID, he forced him into isolation and the surgery was cancelled. The surgeon told us that up to a third of patients were out because of that 14-day isolation rule. Now, when he finally had his operation, the hospital called up and said, are you all vaccinated? We said, yes. Is your son vaccinated? I said, he's 10. And they said, yes, but is he vaccinated? I said, it's not even been approved at this stage. And they turned around and said, and kept asking the question, is he vaccinated? So this was in trying to get into hospital the first time around. The second time around, we just kept him isolated away from everyone to be able to go into the hospital. But those specialists, in the paediatric field, the craniofacial specialists, how can they be utilised, picking up a point on Carolyn said, in a COVID ward? It's just nonsensical.
We've just seen Mark McGowan come out and say that unless parents are double vaccinated, they won't be allowed in to see their children in hospital. And he's actually flagged, he said, well, when he was pushed, he said, well, we will have grounds for a compassionate exemption. Now, if my child's in hospital, isn't that the compassionate exemption on its face?
Well, we actually, in our situation again, Michael, we weren't. We had to be vaccinated to visit my son, and due to the isolation rules, only one parent could go in at a time. So I had to drop drop mum and son off at the Epworth, and then only pick them up at the end of it.
Again, this is insane because there is strong medical evidence, and I know this from my independent children representation work in the family law setting, strong evidence about rates of recovery of children post-operatively when they are surrounded by family and particularly parents. So for them to make a decision that parents aren't allowed in, it's actually contrary to the health outcomes of the patient. I don't understand it. You do a rapid antigen test, for heaven's sakes, get your temperature checked at the door, do everything you need to, but just let the parents in. They need to be there.
I agree with you, and it brings two things to mind. Firstly, the whole bureaucratic circus of trying to get an exemption would take so long that your kid would probably be out of hospital by the time you got it. And secondly, aren't these bureaucrats and these government people parents themselves? I mean, wouldn't they? I mean, I just don't understand how a parent could possibly make a ruling like that.
It's heartless, right? It's heartless, Ryan and John, to hear those sort of outcomes, and particularly your lived experience, John. It's just appalling.
And
Yeah,
also,
look,
sorry, John.
a lot of the hospital in their, I won't say defence, but they and it's a fallback. They say we're following the CHO orders. This is the same as the police in enforcement, particularly last year, would say, look, I don't have a choice. I have to follow the CHO orders at that time. Otherwise, the penalties on the hospital are so severe that they will literally shut them down. So it was the fear of the chief health officer orders that drove them to do that. So yes, they were parents, etc. But yeah, the general fear of the heavy-handedness of the Andrews regime is at play yet again.
I guess I'm talking about the bureaucrats in the departments and the people that are making the rules for the hospitals to live by. But you know, you said the right word, John. It's been fear for the last 2 years. That's right. Been the driving method of getting everyone to do what they're told. People are sick of it.
And as much as there was the cover of health advice, best health advice, and now we find through Brett Sutton, it actually wasn't. It was bureaucrats and politics driving these agendas. Even if there was the best health advice, there still needs to be a moral, compassionate, ethical, because for every action, there's a cost of action. For every inaction, there's a cost of inaction, and it needs to be weighed up. We can do this, but what is the moral and ethical thing to keep people from farewelling? We saw the horrific circumstances of that poor 8-year-old schoolboy who drowned at school camp. One day after Andrews instigated the new restrictions, his funeral, and his schoolmates and family not being allowed to gather, just a blanket ban, no exceptions, no, okay, if we have it outside, we could facilitate this many people. If we have rapid antigen tests, we could just no. And not being able to visit your children, not being able to farewell loved ones, not being able to visit confused and scared aged loved ones in a home who are at the end of their life. It's just, what have we become?
Yeah.
Well, the only good news of that is that Victoria is the number one in this space and playing politics, as I call it, jab politics. But really, the treatment and reaction to the pandemic, et cetera, it's not mirrored in any other country. The little thing with I mentioned earlier about in the UK where the NHS has lifted the mandate for health workers and essential health workers to having a booster, that they actually went into I was reading through quite significant detail. They actually raised the issue, which is pertinent in Victoria. What happens to those health workers that have lost their jobs? And what do you do there? Because a lot of the health situations that we're in now in WA and Victoria is due to, and Queensland too, is health workers being dismissed from their jobs. But they actually had solutions with that and saying that they could reapply, and they looked into it extensively. But that's a bridge too far to come up with solutions here in Victoria.
What you're really saying is we're becoming the worst case scenario of a jurisdiction not to follow.
Around globally. Right. So we've gone from it, you name it, we've had it here. So curfews, no-fly zones, shutting down public transports. You wouldn't have seen this at the height of the Marcos regime in the Philippines. You know, it's a literal martial law. Now, people overseas can't believe it. My Irish in-laws say, did that really happen? I say, yes.
Playgrounds
We lived
closing.
through it.
Yeah, that's right.
All right, team, on that cheery note, on that great way to end, we're going to wind up the Informer, and I'll look forward to seeing you all back next time.
Thank
Thank
you.
you. Thank you.
Thanks very much.